May is Mental Health Awareness Month, a time to shed light on the often silent battles many Nigerians face, and to spotlight the systems that support healing. In this special interview, we pay a visit to Doctor Olugbenga Owoye, the Chief Medical Director of the Federal Neuro-Psychiatric Hospital, Yaba, one of Nigeria's leading mental health institutions, to ask critical questions about the state of mental health care in our country. From access and affordability to stigma and innovation, these questions are more than just interviews. They are a step towards change. Let's begin.
Somebody is said to be mentally sick when there is a severe psychological disturbances in thinking, the memory, the emotion that is severe enough to cause distress or pain to that person or to those around that person. And not that alone, the person may not be able to function socially and operationally. Now there are many things that contributes to the mental health stability, because that's where your question is now coming from. And you're now picking one out of it, which is financial stability. Is that not so? However, when you talk of mental health, there are a lot of factors that contributes to the stability of an individual. Usually, when there is a compromise on the mental health status of an individual, it is usually multifactorial. Maybe it runs in the family, or the person suffered loss of the loved one early in life or around the time of the illness, coupled with maybe unemployment or underemployment with poor financial status. All these things try to combine sort of to precipitate mental illness in an individual. So you don't just single out one factor. Okay? There are many people who are financially stable, but they are not mentally stable. They have the money, but the mental health is compromised. Do you understand? So a lot of factors come together to cause imbalance in the mental health status of an individual. But one of them, just like you said, is the economic status of the individual. Globally, mental health personnel are inadequate. Talk less of low, medium income countries like Nigeria. So in Nigeria here, we have over 200 million people. And we just have over 200 psychiatrists to take care of over 200 million people. So you can imagine. So training mental health professionals takes time. Time apart from consuming time, finances, and then what about the interest of those who want to go into it? Like I normally say, if you are a mental health expert, it is like a calling. Because if you are looking for money, you will not come to say you want to be in mental health. Do you understand now? So, grossly all over the world, the mental health experts are grossly inadequate. That's why you see some developed countries poaching for mental health workers from low-income countries like us, where we don't even have enough. They are taking from us. And let me tell you something. When you talk about how common mental illness is, about 25 to 30% of the general populace may suffer from one form of mental illness or the other. That means 1 out of every 4. 25 out of every 100. So you can see how common it is. Meanwhile, the personnel, the experts, are grossly inadequate. The 9th component of primary health care is mental health. These have been there since 1990. Except probably Lagos State. Most of the states in Nigeria, you hardly see mental health services or experts at their primary health care. This is very, very important, and there is need for us to make noise about it. Integrating mental health into the primary health care. There are some cases coming into our hospital that are not supposed to come in. They're supposed to be managed at the primary health care level, but we are yet to get there fully. But with time, I know that Nigeria will get there because the effort of the government now is now doubled in the area of training of the experts, in expanding the services and facility, and in funding the 10 mental health institutions in Nigeria, because there are about 10 mental health or psychiatric hospitals of this status in Nigeria now. And I know with time, it will spread through all the 36 states of Nigeria, rather than being in the geopolitical zones. When you talk of stigma, there are negative attitudes or stereotypes, or what we can call discriminations against those people with mental health challenges. And these negative attitudes tend to affect the ability of the individual to seek for help because he wants to hide it. Family want to hide it because of this negative attitude or stigma. Not that alone, even the outcome of the treatment may be affected in the process. And these are major issues, major challenges to the mentally ill in terms of their recovery, in terms of their treatment. And that is why we in the mental health professionals, we advocate for those with mental health issues on the need to avoid stigmatizing them. Mental illness is like other physical conditions. You don't stigmatize those who have hypertension. You don't stigmatize those who have diabetes. So why those people with mental ill health? Mental health issues or illness or mental disorders are mainly as a result of multifactorial conditions. That is, many factors coming together, interacting to cause mental ill health. So it's not economic situation alone. Adverse life circumstances, kidnapping, you torture people to death. So people seeing it alone is enough to break down. Talk less of experiencing it. Do you understand what I'm saying? So when you talk of mental illness to develop in an individual, it's not just based on economic status alone. Some people, it may be due to loss of significant others. Some, it may be due to loss of job. Some, it may be due to probably a kind of family dysfunction. the family that is not stable, father this way, mother this way, the child or the children between them can no longer cope. Before you know it, they become symptomatic. So there are a lot of things that interact together. And there are some people too. No matter how terrible the financial situation, no matter how terrible the disasters, nothing will happen to them. They'll just wake up and be doing their own. And that is why the issue of nature or genetic constitution of an individual comes in. Now we can boldly say that we have mental health act in Nigeria. Okay? But it's yet to be fully operational. Take note of that. It's yet to be fully operational. So we are like in a moratorium period where there are some things that need to be put in place for the act to come into full force. But there are some areas of it that have started functioning. For example, if you want to admit somebody involuntarily now, there are procedures you must follow, because not everybody will agree to be admitted into psychiatric hospital. So you must take note of that. Also, the dignity of Nigerians is well taken care of in that mental act. So you must respect the personality of the person you are taking care of. But there are some other areas that are yet to be fully activated. For example, the Lunacy Act. Okay? For example, the Lunacy Act of 1958 now, that criminalize suicide. You know, as at now, if you caught somebody try to commit suicide, it's a criminal offense. You take the person and arrest him and try them. Somebody who is sick. Do you understand? So until when we look at that area, okay, so that we decriminalize suicide, so that these people will have access to treatment, to care, to support, then that's when it becomes, we'll now say, we have a robust mental health legislation in Nigeria. So when the mental health and the suicide act are put together and they become operational, then initially, when the NHIS started, mental health, treatment of mental illness were left out. But in the last 1 year now, with this new administration, now we can now see with the current NHIA that we have, it's no longer NHIS, it's NHIA. Now, with this current NHIA now, there are many of our medications or treatment devices that are now being incorporated into the National Health Insurance. And some of our patients have started benefiting from it now. All you just need to do is to contribute a premium, either as a worker or somebody who is into business. You just contribute, and from there, you have access to your treatment continuously. So now currently, mental health services is being incorporated and also being recognized by the NHIA. Thank you very much. This is another important question. For those who have improved, those who have recovered fully from mental illness, we have a very strong social welfare services to return them back to work if they are working before. Not that alone. If they are not working, we also have vocational training in our our occupational therapy department, where we train them on what they will be doing before they are settled back into the community. In addition to this, we also utilize some non-governmental organizations who are in support of these people after discharge. So we provide shelter for them, feeding, training, and accommodation. In addition to that, we also make sure we follow them up closely. We follow them up closely so that in the process, we don't lose them into the community. So when you talk about reintegrating our patient back to the community after treatment, we take that so seriously through our social welfare services department.
Hope lives where help exists, and through awareness, conversation, and compassion, we build a future where no one faces mental health challenges alone. As we draw the curtain down on this special feature on mental health awareness, remember, reaching out is a sign of strength and healing is possible. Together, we can create a mental healthier Nigeria. Thank you for being part of the journey.